Good evening, everyone. I am Dr. Kushti Ganguly, consultant hematologist and hemato-oncologist working in Calcutta. And today I am here to speak about a disease known as multiple myeloma. Now, this month, March, is celebrated as the Multiple Myeloma Awareness Month. Now, what is multiple myeloma? Multiple myeloma is basically a cancer of the blood, particularly cancer of the immune cells of the blood known as the plasma cells. It is a rare variety of blood cancer amounting around 1 to 1.2% of the population in India, slightly being more prevalent in males than in females, and the median age of diagnosis is around 65 to 70 years. So basically it's a cancer of the elderly people. However, multiple myeloma being a slow cancer is often difficult to diagnose in the early stages because it can present with very simple symptoms like a low back pain, like fractures, like anemia, any of which can be common in many patients over the age of 70. Anybody over the age of 70 can have a back pain, can have an anemia. Sometimes it can also present with metabolic problems like high calcium levels, which can lead to features like constipation, or which can lead to features like encephalopathy, meaning that there is a alteration in our conscious state, which can be confused with a stroke or a coma, which is again more common in patients above 60 or 70 years. So in this way, another way in which multiple myeloma can have symptoms is with chronic kidney disease. Many patients can have chronic kidney disease for months and years before they ultimately develop the other signs and symptoms of multiple myeloma. So obviously, if you have a patient of multiple myeloma, they can come to you with anemia, they can come to a medicine specialist, or they can go to an orthopedician for a back pain or a fracture. They can even go to a nephrologist for a kidney problem, or they can go to a critical care for the emergency problems like altered sense and comatose states. So you can understand that the presentation or the signs and symptoms can be very simple to very complicated. Obviously, it is very difficult to diagnose even for doctors, and particularly because it is so rare, it is also difficult to suspect that a given patient is suffering from multiple myeloma. But herein lies the paradox that if identified early and treated early, most of these patients, around 60% of them, can lead productive long-term lives, and they can survive for a long period of time without having any signs and symptoms of the disease. The treatment also is quite simple. Sometimes it requires chemotherapy, sometimes it requires some oral medications, and also advanced treatment modalities like autologous or allogeneic stem cell transplantation. However, there is no cure for this illness. It is pretty much like a chronic disease like diabetes, where you need to get the patient treated almost continuously through the rest of the life. During this course, the patient can relapse, and with the relapse, again you need to continue or increase the degree of treatment. The most important factor being to suspect that a given patient can be suffering or could be suffering from multiple myeloma. Unless we suspect that, we will never be able to identify or to have the awareness for the disease that yes, this is an entity and this can lead to very severe short-term as well as long-term consequences. Patients can have multiple fractures, they can become bedridden within a matter of months, they can land up in dialysis, they can require repeated blood transfusions, they can land up with repeated infections, they can land up in the critical care unit or the ICUs again and again. All of that is reversible with proper diagnosis and treatment. So, I would urge everyone to be aware of this entity, both in terms of the medical and non-medical persons, to be aware of this entity so that we can identify it at the earliest and can continue or to diagnose and treat it. Awareness is the only tool to increase our survival rates in multiple myeloma. Thank you.